So we're talking flu season today. Unfortunately, there have been some deaths this flu season. That's kind of where I want to start. If you can comment on deaths, I guess nationally, but also Texas and then possibly Travis County, just to kind of confirm where maybe around the state those occurred.
Sure. So, we know that in the state of Texas we have 8 cases total. We're also aware of a potential 9th case in Dallas. Luckily, in Travis County, we haven't seen any deaths associated with pediatric cases this year.
So none in Travis County, you said?
None in Travis County.
Tell me about, whenever there is a flu season with deaths occurred, does that ever increase the message, or is it that message always increase? How do you approach, whenever you hear the sad news about deaths?
Well, we know every year there's going to be deaths associated with the flu, which is why we really stress the importance of the flu vaccination before October to try to mitigate that risk. It is unfortunate every year that we do see flu, but we're hopeful that as immunizations increase, we can decrease the impact from flu.
I know in the press release there was some big numbers nationally on just the toll that the season has taken so far. Are those alarming to you?
They are alarming, and to some extent we expected that we were going to have a bad year. When we talked in September, we discussed the flu season in Australia, which was particularly bad. And we know from prior history that there's often a good correlation between what happens in Australia and what happens in the United States, and in fact that's happening.
Why is it that that's expectations are based off of that? Is it just how things get around, or is it?
Yeah, so it has to do with how the flu changes. So we have something called drift and shift. Drift is when it changes subtly. Shift is when it changes significantly. As they drift and shift, the immunizations become less effective, which gives us greater concern.
Is that based upon the virus itself, or the mutations are now the vaccine isn't as effective, or?
So yes, the virus will change, and if the virus changes significantly enough, you won't get full immunity from that immunization. We do know that the World Health Organization in September recommended changes for the Southern Hemisphere for 2020, which gives us some indication that our coverage for those particular strains may not be as good as we'd like.
Does that fall more on the virus itself, or the flu shot being given out on the increase in people getting the flu?
Yeah, so it's really both elements. For the Northern Hemisphere, they meet around April to try to decide what to put in it, and they start creating it. Between April and when it arrives in the Northern Hemisphere, there's sometimes significant changes. So it's a constant catch-up that we're trying to play.
Oh wow! I've seen stories where you get your flu shot, but unfortunately some people still get the flu. Is it always a trial and error on whether or not you can actually 100% prevent it?
It is. When we have a good flu vaccination, we may get 60% effectiveness. It's not 100%, but there's also 4 different strains that primarily circulate. So while the flu shot may be less effective against one strain, it may be substantially more effective against another strain.
Okay.
Primarily, we've been seeing flu B, but we are starting to see influenza A increase, which gives us some concern that we may see a second peak here later in the season.
Can you maybe break down those two? Is one more severe than the other as far as symptoms, or is it just a different type of?
So flu B tends to be more severe in children, and that's because they have less exposure to flu B in the past. They may not have had flu. But flu B is less impactful in adults because it changes less. So it tends to drift and not shift, whereas influenza A changes more significantly, and we can have a greater mismatch with that vaccination.
Is there always, you see one before the other typically in the season, or?
Almost always it's primarily influenza A, so this is quite unusual that we're seeing a predominance of influenza B. We haven't seen this since the 1990s.
Is there any way to correlate that to the amount of deaths so far this season, or is that hard to say?
So the Pediatric deaths are more often associated with influenza B because it does tend to affect children more severely. So we do think that is as a result of the influenza B being the predominant strain.
And as far as flu shots this year, does it seem like there's been an decrease in the amount of people getting them beforehand, before the season starts, during?
So it's hard for us to tell at this stage. Generally, we'll assess that at the end of the flu season and also do the calculations on how effective those flu shots were.
Okay. I'm trying to think. I'm assuming, you're still going to tell people, get your flu shot. What else as far as preventive measures can people do? And as far as timing of shots, is it, I'm assuming, better to get them, early is the best?
The best time for folks to get their flu shot who haven't been immunized is today. We still have 5 months left in the flu season, so it's absolutely not too late. The other important things are for folks, if they are sick, to not go to school, not go to work, not go to public gatherings to reduce the transmission risk. The other big things are to make sure folks are washing their hands, that they don't touch their face, and if they are sick, that they see or talk to their doctor about getting treatment.
There's a big thing about, I've read, if you feel like you do have the flu, to not go in. What's the sort of theory behind that?
So this is an important thing to remember, that most flu can be managed at home. If folks think they have the flu, the best thing to do is to call their doctor. If their health insurance or their doctor's always has a telemedicine resource, that's the best way to avoid exposing other people in the waiting room. And this is particularly important because last week we had a substantial rise in the number of ER visits and hospitalizations related to the flu. So the leaders of the hospital systems have asked us to remind folks not to go to the ER if you have the flu, which is a mild case. That can be treated at home or with their primary care physician.
What's the big idea behind that, to not clog up the ER with people that might need emergency services?
Right. So last week we had some hospitals, ERs, that were at 170 to 190% capacity, which means people with heart attacks or strokes are often trying to compete with those that have flu. Folks that have minor illnesses are best suited, again, at their primary care office or an urgent care center.
And I saw there was a breakdown between child and adults, but also what was deemed severe symptoms. Can you sort of, I know there's a few, but if you can kind of point out a few big ones that, if you're experiencing these, maybe you should seek emergency services? So
some evidence of severe flu may be chest pain, significant difficulty breathing, or lightheadedness, dizziness, or fainting. These indicate that the flu may have gone from a simple infection to complications like pneumonia or sepsis. In those circumstances, those people need to go to the ER.
Okay. And as far as children, is it just the case, I know with these deaths, is it that they're more susceptible to the symptoms, or is it it's harder to tell the symptoms they have? How does that all?
It's pretty easy to tell flu during flu season. And our advice for parents of children who are sick, who they think have the flu, is to call their pediatrician, talk to them about what's going on, and get advice on whether or not they need to come in.
Okay. Is there anything beyond that point, as far as steps to take for parents, their children, if they have the flu, beyond calling the doctor? Is there any medicine they should be on the eye out, keep their eyes out for, anything like that? So
we do have 2 different medicines to treat the flu, and those both have to be prescribed by a physician. That's the only real treatment that we have. It does show that it does decrease complications, it does decrease the length of the illness, and it's important to talk to their physician about whether or not that particular medication is right for them or their child. Great.
Is there anything maybe I missed that you'd like to bring up?
Flu's bad. No, it's, I think the take-home point really is it's not too late to get the flu shot. Last year we had flu season, which extended well into May, and we don't know where it's going to go. Because of the activity in the hospitals last week, our expectation is that when we have the numbers released on Monday, that we're going to see a substantial increase compared to week 1 of 2020.
As far as predicting how a year is going to go, is there always any hope? Or I know you're based in what Australia experiences, but is there any way to kind of get ahead of that curve? Is there anything being done as far as, is it always a kind of a try to keep up with it mentality?
Yeah, every season's different, and that's part of the challenge. Again, we do look to what's happening in the Southern Hemisphere, particularly Australia, because it does tend to reflect what's going to happen here, but it is a little bit of a guessing game.